Hey, good morning, good morning, good morning. Welcome to another episode of CV's Corner. And today we are going to do Ask the Dentist. That's another theme of the CV's Corner. As I told you last time, the next time we meet, we were going to talk about dental issues. And today I am so privileged and honored to have in studio with me two awesome dentists, two of the most wonderful ladies that I know. Of course, my wonderful wife, Dr. Cressida Joseph, and our very good friend, Dr. Peach Dor Tyrell. So welcome to CV's Corner, ladies. It's a pleasure to have you with us. Oh, I feel like I'm a king, all right, surrounded by two beautiful queens. So just to let you know, Dr. Joseph originally is from the beautiful island of Montserrat. And of course, she is a graduate of Tufts School of Dental Medicine. And Dr. Peach Dor Tyrell is from the island of Nevis, or as they would say, the Federation of St. Kitts Nevis. And she is a graduate of Boston University School of Dental Medicine. Mm-hmm. So these are two highly educated and knowledgeable people. And so we're going to ask questions that are pertaining to dentistry and overall health. There are a whole ton of questions to ask. We don't have a whole lot of time to answer all of your questions, but we'll do the best we can to give you some clarity. And we just want to make a disclaimer. We're not diagnosing and we're not treating any dental situations. So if you have any problems, go directly to your dentist. Okay, so Dr. Joseph.
Yes, sir.
How long have you been in dentistry?
Wow. How old is my first daughter? Like 20, our first daughter.
28
years, yes.
Oh, awesome. Yes. And for you, Dr. Dor?
Well, as a dentist, over 25 years.
All right, so we have lots of knowledge here. Okay, so you're both general dentists.
Correct.
You are the CEO and president of Beacon Dental Group. And you are the CEO and president of Peachy Smiles. Awesome. Oh, you guys are just awesome. Okay, so what are we going to talk about? So when we talk about dental health, people tend to divorce one from the other, divorce dental health from overall health. But we have to put both of them together. Correct. Because your dental health affects your overall health. Would you agree?
Totally.
Because dental health has an impact on every aspect of our lives, from our brain all the way down to our toes.
Correct.
And so we're going to approach this session with that in mind. We are going to talk about how our hygiene, good hygiene can lead to good overall health, and our poor hygiene can lead to poor overall health. Talking from heart disease to diabetes, high blood pressure, even Alzheimer's, and all kinds of diseases are related to our dental issues. So, Dr. Joseph, I'm going to start with you. What is the incidence, or how do you see in your practice or in your experience, how are people taking their dental health seriously? And what are some of the things that you have noticed over the years as it pertains to poor dental health and overall health?
Very good. So yeah, in my experience, I've practiced in the area where most of our patients tend to be minorities. And I have found that the majority of people over 45 or 50 years old come in with quite a few systemic diseases, such as diabetes and high blood pressure and so forth. I find a lot of us have either one or the other, or actually both. And so I think it's very important for us to really work hard at getting our patients to really understand that these are issues that we need to take care of. As a people, we have a higher incidence of these diseases in our community. So it's time for us to do something about it. And we are really in the field where we could really make sure our patients understand that this is something we need to work at. And the good thing is that it can be improved and in some cases even stamped out.
Yes. Thank you very much. And so, Dr. Dor, I would imagine you have that same experience.
Yes.
But can you be a little more specific as to what you've seen directly related to poor oral hygiene? Is diabetes something that is prevalent in some of the people that you have seen, or high blood pressure, or heart disease? What have you seen that is a very prevalent issue in your practice?
Yes, in my experience, both diabetes and high blood pressure presents as a common factor in over 50% of my patients, especially those over 50. And what I try to focus on is the prevention part. So we have lots of studies that have demonstrated that poor oral health, which is due to harboring bacteria in your mouth, does complicate these diseases, diabetes, high blood pressure, and it also contributes towards managing or controlling these diseases. So it's always a good thing to start where we can, where it's easiest. So I tell people to concentrate on keeping your gums healthy, keeping your mouth clean. That way, you are able to keep the inflammation at bay, and with good oral hygiene and your medicine, you will be able to control these diseases that would otherwise lead to even further complications throughout your body. For example, your heart, your pancreas, your kidneys. So it's good news that something can be done.
Yes. Well, thank you so much. And so Dr. Dorr talked about doing the easiest things that we can. And that's how we actually want to work things, starting with the easiest and go with the more complicated. So in terms of oral hygiene, what would you recommend in terms of what's the frequency? How often should one have their teeth cleaned?
Easy, that's easy. You should visit your dentist at least once every 6 months. Get a dental cleaning and a dental checkup. Make sure things are checked to make sure you're functioning well and things look healthy. However, if a patient is diagnosed with gum disease, which many of the diabetic patients actually would present with gum disease, especially if it's uncontrolled diabetes, then in that case, it's every 3 months. Now, there's a reason why that is recommended, and I'll have Dr. Peach talk about that.
Why is that recommended?
Well, it has to do with, back in school when you talked about flora and talking about the bacteria in your mouth. After a cleaning, you get to start over. You're given a clean slate and all the plaque and bacteria is removed. And then it takes a while for these bacteria to repopulate your mouth. And so for people who have periodontal disease, which, one of the ways they have probings, when we do the measurements, they have well over 3 millimeters of space in between from where the color around the teeth begins to where the sulcus ends. So with these higher probings, they're harder to keep clean, and so it's easier for the bacteria to get repopulated, so you have higher numbers again. That takes 2 to 3 months to occur in cases where you have higher pockets, if you will, between the teeth.
Okay.
But for people who are pretty healthy and have 3 millimeters or less, then it takes a longer time. Then it takes 4 to 6 months for the bacteria to be in high levels again.
Okay. Yeah, so by the way, I happen to have a little knowledge in that area as well. And as a hygienist, you're absolutely correct. We were told in hygiene school that it takes about 6 months after you have a cleaning for the bacteria to return to its normal levels. That is, people that have, as Dr. Dorr described, probings that are 1 to 3 millimeters depth. But if you have beyond that, it takes about 3 months for the bacteria level to return to what they were prior to the cleaning, and therefore the recommendation for having every 3 months as opposed to every 6 months. And so when we talk about inflammation of the gum, there are stages, right? We talk about gingivitis, and then that leads to, if we don't take care of that, that leads to periodontitis. And so people ask, what is periodontitis? Can you, in layman terms, just describe for the general audience what is periodontitis and why we are talking about it's imperative that we do what we need to do from an oral standpoint, oral hygiene standpoint to curb that disease?
Yes, so periodontitis is bone loss, basically. It starts out many times with bleeding gums. If you have an area of your mouth where your gums bleed for whatever reason, while you're flossing or brushing or spontaneously, that's a problem. The people, oh, it bleeds a little bit. Yes, that's a problem. That's gingivitis. And that, if it's not checked, it goes on to periodontitis, which is bone loss. And if you could just imagine, if the bone is supposed to be up around the neck of the teeth, and now it's dropping, then the teeth get loose over time, and you lose teeth. You lose teeth, the gums are spongy, and this is a problem, because now you don't chew well, you have pain, you have inflammation, you have other issues. And there are many reasons why people could have periodontal disease. As we said before, systemic issues like diabetes, high blood pressure, other systemic issues, as well as smoking, other habits that cause smoking anything. A lot of people, I don't smoke cigarettes. Smoking anything can cause periodontal disease and gum disease. So we have to be careful, and we need to do, again, Dr. Dewar talked about, do the easiest thing first. So get your checkup, get your cleanings, and at home, it's recommended that we brush our teeth at least twice, recommended 3 times a day you brush, and floss between your teeth once per day. This is what gets rid of the plaque, because it's the plaque that sits between the teeth, around the necks of the teeth, underneath the gums, that would cause gum disease or periodontal disease. And if this thing is not cleaned, it'll just get worse and worse and worse. And over time, you get teeth get loose and they fall out, or they have to be removed because now they're hurting and there's infection, there's an abscess, and so on and so forth.
Well, thank you. Dr. Joseph said a mouthful here. And so, okay, so when you have periodontal disease, in order to get rid of it or to at least control it, you cannot regain the bone, right? But you can maintain the level where it is. What is a procedure that we do to get that particular patient back to a place of quote unquote normalcy?
Well, that would be a scaling. And that has to be done professionally at the dentist's office. We use our fearless little instruments and get in between and really get down and deep in between and in the pockets and remove all the plaque, debris, and flush out all the bacteria. In severe circumstances, there are some people who will need to have periodontal surgery to repair the bone loss and the tissue loss as well. But that's why it's important to just start with the brushing and brush really, really good twice a day. Because if you do that, say morning and night, you will make inroads into keeping bacteria at bay, which is the main causative agent of periodontal disease.
Okay, and then we have many ways to help with the home care. We do our flossing, as you say, but there's also these water picks that work wonderfully.
Mm-hmm.
I'm not pitching anybody's thing, but I'm saying from a dental perspective, there are things that we can do at home, and many people tend to wait until they get to the dentist. You got to do what you got to do from home. Do the basics. And when we do that, then we have a better outcome. Dr. Joseph, you talked about smoking. Mm-hmm. And one of the things that we have found in dentistry is that, at least based on what I read, 80% of all oral cancer is smoking related, 80%. And of course, if you smoke and drink, there's another 10% that you add to that. And so have you, in your experience, seen any oral cancers? And of course, we know the incidence of oral cancer, the death rate is very, very high. Can you talk to that, please?
Yes, so oral cancer, yes. So this is one thing that we do. Dr. Peach does it, I do it in my practice, is that we do an oral cancer screening once we do an examination. This is why it's important as well to visit your dentist. So the lips, the lymph nodes under your tongue, your cheeks, your gums, around your TMJ. We check these areas for anything that looks abnormal. And yes, we've been doing this for years, and thankfully we don't see this often, but we have diagnosed oral cancer. Most recently, maybe 2 years ago, in my practice, we diagnosed a cancer of the palate and was able to get this patient over to the surgeon and have it removed. But it was a big deal, and it's important to do this. Have you, Peach? Dr.
Yes,
Peach?
yes.
Yes.
I have also discovered oral cancer, and thank God it's not often, but we have found it, and so it's important to get checked regularly so that you can, get cured, because early detection is
key.
absolutely important. That's the key. So the earlier you find it, the more likely that the treatment will be successful.
All right. Amen. Thank you for that. And so what I've also found out about good oral hygiene is that if you do it and you do it well, you will also introduce it early to your children. And one of the questions that we get asked a lot is, how early should I take my child to the dentist? How early should I take my child to the dentist, Dr. Joseph?
I didn't get that.
Before they're one, they should be in to the dentist. So I tell my patients, bring the babies to me. I love them, bring them. So before they're one, because teeth show up at about maybe 6 months old, 7 months, some of them. But definitely by the time they're one, they should have seen a dentist. It's very important because we want to make sure that things their nutrition and habits, good habits, are being formed. So yes, by age 1, they should be at the dentist. A lot of people come into me saying, oh, my baby's not 6 years old. Where are people getting this idea that you have to be 6 years old before you take your baby to the dentist? No, by age 1, bring them.
Well, that is why we have this program, so they can know how early they should bring their children to the dentist. And so, Dr. Dorr, if they don't take care of their kids' teeth, we have a situation what they call BBC, baby bottle caries, and that's a terrible thing. And you can Google that and see how terrible that looks. Can you speak to that to some degree? So these new patients, these new mothers, new parents will see the importance of taking care of the children's teeth at a very early age.
Yes, unfortunately, baby bottle syndrome, that's still happening even today. That's why we preach, come to the dentist as soon as the baby has teeth. That way you can start them on just getting comfortable with the dentist, looking in their mouth. That way we can keep the parents aware of, oral hygiene, keeping them on the right track. With baby bottle syndrome, it's caused by having the baby sucking on the bottle and lying down, sometimes going to sleep with the bottle in the mouth, because then you have the milk or whatever they're drinking, the juice, it does have sugar, and it's bathing the teeth, even the precious little baby teeth, in these fluids filled with sugar and acids, and so you do have breakdown of the teeth. So you have these otherwise healthy kids with rampant caries. Every single front tooth in their mouth, upper and lower, you can look. When they smile, the holes are there. The brown stuff, you can tell. You don't even have to be a dentist to see that they have caries. And so this can be prevented You try to make meal times more structured so that the baby is not running around with this bottle constantly in their mouth. That's the number one thing to prevent. So you feed them and then you take the bottle. That way they're not there with the bottle in the mouth, constantly bathing the teeth in this acidic environment.
Yes, and so you don't have to necessarily have to brush the child as a kid, but you can wipe the teeth using a wet cloth so that the child never goes to sleep with milk or sugar from the juice on the mouth. So that's a good
Definitely.
thing. And of course, you don't know that if you don't go to the dentist. Or
Right.
of course, if you don't read. So absolutely, take your child to the dentist. There's a thing we used to say at Beacon Dental, first tooth or first year. And of course, the kids, they start getting their teeth around 6 months or thereabouts. And
Yeah.
by the way, talking about that, what I have noticed over the years, Dr. Dorr, Dr. Joseph, is that what we learn in school in terms of when teeth appear, it's not the same. One of the things that I notice
Yeah.
a lot is the wisdom teeth. I was told that they come in between 17 and 21. And lately, a lot of
Yeah.
14-year-olds have all 32
Yep.
teeth in their mouth. How do you explain that, Dr. Joseph? How do you explain
I
that?
have no idea. I'm just thinking it's evolution. Like we're
Evolution.
evolving to evolution in the sense that we're, evolving. Things are changing, and over time we're getting, and who knows, the food, the water, who knows. But yes, younger and younger children are getting these adult teeth and so forth.
Yeah. What is your take on it, Dr. Dorr?
Evolution.
Evolution.
We are constantly changing, and just how the rest of our body changes, our teeth right there with it is gonna keep up with what we need at this time.
Well, I think it's our food. I think it's our food and our drink. I think they're putting a whole lot of hormones in there. And I mean, I have no proof of that, but I would like to think, I mean, I see people where I'm like, okay, your 12-year molar should be around 12 years old, and the kid is 9 and they have their 12-year molars already. Something is happening. But I want to jump a little and talk about, because my boss told me to ask you all about insurance. People think they need insurance before they go see their dentist. Is that true? Can you see a dentist without having insurance, dental insurance?
But of course, you don't have to have insurance to see the dentist. There's a big difference between medical insurance and dental insurance, in my view anyway. Medical insurance covers a lot of what you need. Dental insurance is just a little help. It really is just a little help. So people without dental insurance, you haven't lost anything. You just need to come into the dentist. There are many programs that we have set up for people who are paying out of their pocket to make it easier and affordable for you to see the dentist. And going forward, I think there are going to be more and more plans for people like you who may not have dental insurance, so that you can see your dentist and make sure that you're up to speed with your mouth and your oral health, and making sure that you're healthy. It's very important.
Yes, and Dr. Dorr, I would think you would say, we prefer cash anyway.
That's true. And I think too that the younger generation, they're not scared by the different plans. And I'm being impressed with how they're able to go online and pick a plan themselves and figure out, this is what best suits my needs. And also, there are many aesthetic options that are generally not covered by insurance. And so I find that they are not letting that stop them from getting the treatment that they need. For example, teeth whitening, braces, other aesthetic options, veneers.
Right.
Yes. So it's definitely something to consider, that insurance is there to help you, but it shouldn't be a deterrent to accepting treatment that you need.
Right.
Well, yes, and I say that because several people have come in and I'm like, well, when was the last time you had a cleaning? Well, it's been years because I didn't have insurance. And I'm like, okay, so when was the last time you did your hair? And do you need insurance to do your hair? I say, oh, and it's like a light bulb just
Goes on.
goes on. I'm like, no, you don't need insurance.
Yeah.
I mean, certainly, and I know even in our practice, and I'm sure in your practice, Dr. Dorr, you make arrangements for
Of
people
course.
that may not be able to pay a procedure, you know, on a one-time basis, but you can work with them. So people, if you're listening out there, you don't have insurance, but you have concerns, you should definitely go to your dentist. In fact,
Yes.
you don't even have to have pain to go see your dentist, because a lot of people that are healthy and have no pain, when you go in, it's amazing the kinds of things that you can discover that you need to do, especially if you haven't had a clean in a long time. A deep scale will certainly help you if you have any systemic issues such as diabetes or even high blood pressure. So yes, we are coming down to the end of our broadcast. I know there's a lot to talk about. We've spoken about a whole lot of things. And so I just want to throw it out there for the people that in the coming weeks, and we do this every other week, we're going to have specialists that will come in and talk specifically to certain issues. And we will set up a telephone number that you could call, and you could have your answers, your calls and your answers will be given by those professionals. So this is our first As the Dentist broadcast. I trust that we have answered some of your questions and put some of your fears on the side so that you can do what you need to do to take care of your overall health. Remember, without your teeth, you cannot eat properly. And they say if you are not true to your teeth,
Yes.
guess what?
They'll be
They'll be false
to you.
All right.
May
Yes,
I say one
yes,
thing,
go
really
ahead.
quick thing?
Go ahead.
If we wait till till we have pain, it's many times too late at that point, at least to try to save things. So let's come on in. We can help you before we get to that place. Something that could be solved really simply with a simple procedure becomes really difficult and more costly if we wait too long and now you're in severe pain.
All right, thank you so much. And I want to thank Beacon Dental Group for sponsoring this program today. Beacon Dental Group for all your dental needs. And of course, we have Peachy Smile located right at Ashman Street. What is the address, Dr. Dorr?
172 Ashman Street, Dorchester.
172 Ashman Street in Dorchester. For all your dental needs in our neighborhood, contact Peachy Smiles or Beacon Dental Group, where you'll get all your dental needs met. We thank you so much for looking. God bless. Have a wonderful day.
I can
You were great.